ball became dead by contact with the ground. It is Walpole's ball.
Jim Ashley has no ordinary job. He's a professional referee, athletic all his life until his knees gave out.
Straighten this knee out for me now.
Years of conservative treatment, medications, injections, physical therapy no longer helped, but Jim feared the traditional knee replacement operation.
I had known people who had had the full knee replacement, and I knew how invasive it was.
Jim's doctor, Richard Smith from St. Anne's Hospital, thought Jim would be the perfect candidate for a new procedure, a robotic partial knee replacement called MAKOplasty. Several Steward healthcare hospitals had become the first in Massachusetts to offer this less invasive procedure, and with excellent results.
We'll grip the machine.
Powered by a robotic arm, the MAKOplasty prepares the bone so the implant fits perfectly, offering a new level of precision and accuracy.
The advantage for the patient is less injury at the time of surgery, more precise reconstruction of their partial knee replacement, and a quicker recovery with less pain.
Patients who have full knee replacement often spend many days in the hospital and rehab facilities, but Mako was different.
I went into the hospital that morning at 2 o'clock in the afternoon. I was walking the floor. A few minutes later, I was climbing 5 steps on the same day of the surgery, and I went home the next day.
Professionally, it's very satisfying when you see that the outcome is as good as advertised.
Now, Jim is once again working on his golf game, and he's a familiar figure at his health club. Jim says he has his life back.
Everything else looks really perfect.
Dr. Richard Baker is a busy dentist in Braintree who also lived an active life until a torn meniscus took its toll.
I put on probably 50 or 60 pounds over the last 5 years because I went from playing golf, always walking, to riding in a golf cart. Exercise was very limited because the knee just wasn't cooperating. You couldn't get on a treadmill, it was just uncomfortable. So you start give away things. You might do some work in the yard, but maybe you wouldn't because it was, so you start giving away your life. You know, you start giving little pieces of it away until one day you find yourself sitting in a chair and not doing anything.
He was getting depressed. And this procedure returned him back to his normal life.
Orthopedic surgeon Dr. Leonid Dubersky of Quincy Medical Center was enthusiastic about MAKOplasty for Dr. Baker. He knew that with a busy dental practice, Baker couldn't take weeks or even months off of work to recover.
When I left the hospital, that was the last pain medication that I needed to take. From that point forward, even during the physical therapy, I didn't need any of the pain medication. So I had therapy in my house for about a week, and then I went back to work a week later.
Now, Dr. Baker can once again navigate the steep stairs to his office, and it is only the beginning, he says.
Now I know that I'm getting better after the surgery. I'm improving, and I will improve to the point where I'll be back pretty much to normal again.
MAKOplasty is now offered at Quincy Medical Center, St. Anne's in Fall River, and Norwood Hospital. And doctors are now using Mako on patients with more complex knee issues, and even on hip surgery. Next on the horizon, total robotic knee replacement.
I think eventually it's going to be a gold standard. Absolutely.
The gold standard.
That's how other procedures will be measured in the very near future.
Orthopedic surgeons have discovered the value of this new technology, and even doctors who were once skeptical are now believers.
I never had so much excitement about my work because you know how successful you're going to be. You know how satisfied your patients will be. Knowing that the patients I operate on today will be walking out of here tomorrow after replacement of their joint is mind-boggling. Even now that I'm doing these procedures, it is still mind-boggling.